Hello, in this video I'm going to show you some past exam questions for SAS, and I'm going to talk you through the mark schemes and the examiner comments because I think this might be quite useful so that you know what are they after for certain questions, and then you can have a go at them and hand them in for some feedback. So question from 2018 was, in the key research by SAS, he states there's no such thing as mental illness. How does Szasz defend this claim? So basically, why does he say that there's no such thing as mental illness? So on the mark scheme, there's quite a few things you can talk about. So it says you can talk about how some bodily illnesses are wrongly diagnosed as mental illnesses. So the idea that maybe underlying that mental illness is a bodily brain disease. However, Szasz does say there's no evidence for that. Szasz also talks about how mental illness is just a judgment, this idea of it being kind of a social norm to behave in a certain way. So it's almost like the social context is creating what's considered mentally well and mentally ill, and this idea of suggesting that people are behaving in a bad way and therefore are sick and ill and need treatment. So you could talk about that. You could also talk about how it's become more of a legal definition rather than it actually being a mental illness. So just this idea of now that people who've got mental illness are coerced into being sectioned because it's state sanctioned. So you can talk a little bit about that. You can talk about it being, it talks about medical, political construct, it's society's judgment. So it's all, essentially, if it's only 3 marks, you could probably just talk about how Szasz is suggesting that there's no evidence for any bodily disease. And even if there was, mental illness would just be a symptom of that, and that actually it's just judgments from psychiatrists about what's considered normal, and therefore if you're not normal, you mentally then require treatment. Szasz mentions derogatory labels, but he doesn't refer to labelling theory, so you can't talk about stickiness of labelling and things like that, like you learn about in Rosenhan, and it talks more about this in the examiner comments. So it says, Szasz points out about the medicalisation and politicisation of mental illness. These things were often cited by people, but the ability to explain how he defends the claim varied dramatically. So it's this defending this claim that mental illness doesn't, there's no such thing as it. That's what you've got to be referring to in your answer. Some candidates confuse this view with that of Rosenhan, so talking about labelling, or believe that Szasz thought there was such a thing as mental illness, which he's obviously saying that there isn't. It's a metaphor for maybe something that's underlying, but there's no evidence for that anywhere. Better responses address the claim that mental illness was a myth. So that's how you would approach that one. This one came along with evaluate that Szasz suggested there was no such thing as mental illness, so positives and negatives of this. So the mark scheme suggests for AO1, arguments should be illustrated with appropriate examples. So examples of mental disorders, cultures, diagnostic manuals like DSM, ICD, you can put things in like that. Comments for AO3 should be supportive or critical, so generally you want to go for maybe a positive and a negative, but you don't have to if it says evaluate, because it says or. In defence of Szasz's view, for example, candidates might point to the way in which judgments about what counts as mental illness can vary over time and between cultures, so could be quite subjective. You can talk about things like homosexuality and ADHD going in and out of the diagnostic manual. Further supporting this idea that there is no such thing as mental illnesses because they're created by what's the social norms of the time and the culture. There's also a little bit in the historical context that we learn about where you're more likely to be diagnosed with schizophrenia if you're from an African background, and so you could bring that in as a bit of evidence as well, although it's not specifically in Szasz, but you can give it as an example, which is what this top bit's talking about. They could also point to biological explanations of specific mental disorders. So, you know, talking maybe a little bit about what you learned about in the medical model. Against Szasz's argument of there being no such thing, you might cite examples of disturbances that would elicit concern in any location at any time. So, for example, you could make reference to schizophrenia. Maybe those kind of symptoms, it wouldn't matter, you know, like if he talks about it being kind of like a human condition, but to have hallucinations and delusions, that's not something which everyone experiences. So clearly that does indicate that there are some mental disorders that do require treatment. So that could be against Szasz's. They could also make reference to the way in which diagnosis of mental illness can open the door to support. So, you know, you could say this idea that there's no such thing as mental health, well, a negative of that, a weakness of that, a consequence of that is that it means that you wouldn't get the support for the disorder, whereas if you say, well, there is mental disorders, then people can get treatment for it, they can get that label, they can get help, they can get support, they can feel better. It says to be able to access the top band, candidates are likely to explore more than one argument. So obviously you've got to explore two things because it's out of 5 marks. That would make sense. So it says that typically at least 2 lines of argument will be explored with relevant supporting evidence. You need some evidence in there. The examiner's comment says many candidates struggled with the skill of evaluating. I think that's probably more because it's a Szasz's study rather than actually not being able to evaluate. It says the more helpful structure of response suggested how Szasz's argument could be defended and then how it could be criticised. So 2 points. This was a sensible way of approaching the question and there was some thoughtful, sensitively handled discussion. Too many commentaries were shallow, such as we know there are physical symptoms, so Szasz's must be wrong to say it doesn't exist. So in that one, you'd need specific examples of I mean, in fact, just saying physical symptoms, well, that doesn't suggest that there is a mental disorder. But if you said something like schizophrenia with hallucinations and delusions, and you linked it to this aspect of any location at any time, then you would have got that would have been a little bit deeper of an explanation. Let's have a look at this one, which we set for homework to finish off. So this one says, the author refers to medicalisation of disturbing or disturbed behaviours. What does Szasz's mean by this? So this is the section where Szasz's talks about in the late 16th century England, we've got that religious humanistic view where the suggestion was that life is tragic, everybody suffers. It makes reference to Macbeth, Lady Macbeth. So it's moving away from this view of personal suffering being something that, you know, you can treat yourself basically by analysing your thought processes and what's going on for you and thinking about your emotions, where they come from, a little bit like what you kind of do in therapy. You know, you would have done that before with someone in your family or community, or you might have done that with somebody who was religious. So this something requiring divine assistance means going to your priest if you were Catholic, or, you know, a rabbi, or whatever the kind of person is that is at the head of the religion. So that's the past. And then now it's been medicalised, so there's a movement towards behaviour being perceived as disturbed or disturbing, and it being a medical disability that requires treatment. So it's this idea that you're labelled as being sick and you require treatment. You know, before it was that, okay, you've got something that's quite normal, quite human, and that you can help yourself with that by talking about it with somebody else who might be a little bit wiser than you and give you some assistance. Whereas now the medicalisation is you are physically, mentally unwell, you need some treatment, and we're going to force that treatment on you because now it's state sanctioned, you're going to get sectioned, and you will be treated. You can't refuse that treatment, you can't get a second opinion. So it's medicalising this idea that there's some kind of disease. So Szasz's is saying that mental illnesses are being treated like they're a physical disease, and actually there is politicians like Bill Clinton who was saying that they're the same, and the medical model says that they're the same. So Szasz's is criticising that and saying, you know, this medicalisation is not helpful, and it's not helpful because medical patients are being seen as passive victims of it, and that it's out of their control, rather than in the past where they were active players and they could, you know, improve their own mental state, which is the belief of therapy, which is what Szasz is kind of more in support of, which is why he's in the alternative explanation. So for this one, you're basically saying what they thought in the past, what medicalisation is, and then kind of a consequence of that. That would get you kind of 3 marks for it. The next one is medicalisation of behaviours problematic? So again, because it says the extent to which you see it a problem, 5 marks, you want to kind of do both sides, so why it might be, why it might not be. So we've got, it's a good thing that the disturbances of the mind are medicalised, because then if you're experiencing them, you can feel quite reassured that, you know, there's something that you can do about it, that your experience is not completely unusual, and that you can actually get treatment for it. So, you know, imagine you've got schizophrenic symptoms, you are hearing voices, you've got delusions, you're very kind of fearful of that. It might be quite reassuring to find out that that's quite typical of schizophrenia, and that you can get treatment, you can have some tablets which will, you know, prevent you from having excess dopamine, which is what the medical model says, or maybe just get some therapy, which is what Szasz is more on the support of. Also, if it is viewed as being equivalent to physical illness, we'll probably get more funding for mental health services, which will of course be very useful, because then if we get more funding, people can get more treatment. Now, the opposite side of that, the opposite position, is that if you treat disturbances as medical events, then what you're doing is you're making people be at the mercy of the state and the judgments of psychiatrists, and so you are forced to be sectioned against your will if they deem you to be at risk to yourself or to other people. So if the behaviours are not approved of and they're labelled as illness, then you are, and if they're differing from the norm, you can get locked in a mental ward, which means that you can't really get out of that, in a similar to what we learn about in Rosenhan's study. It's quite difficult to convince them that you are sane, and so that could be a negative. Now, bearing in mind, you know, some people are a danger to themselves, to others, and they benefit greatly from being in mental health institutions and, you know, hospital wards. So it's not to kind of, you know, we're being very kind of sensitive towards that, but this question would allow you to kind of make those points and get the marks in that way. Next question, usefulness of SAS. Why is it useful? Very similar to kind of what the previous question is. Maybe 2 3 markers, so 2 points. The injunction assess means you've got to weigh up the usefulness. Well, in fact, just let's go back to this question about problematic. It does say the extent to which, so you do have to make a comment about the extent to which it is a problem. So you could say, well, it's a problem to the extent that people can be sectioned against their will, but then maybe it's not as problematic because people do get the treatment that might help them. So you can make an overall comment at the end about that to get in that top band. Otherwise you can't get in there because you've got to kind of comment on the extent to which it is a problem. Going back to this usefulness one, so we've got could be argued useful in exposing the politicisation and medicalisation of psychiatry, and trying to kind of encourage counselling and voluntary clients rather than being sanctioned, so state sanctioned and being sectioned. So maybe it will change social policy, and so then people will have more of a right, or at least have kind of like family choice to make informed decisions about their treatment. And actually it has changed because people now can, you know, decide on how they want to be treated, but it depends on the disorder. If it's something like schizophrenia, or like anorexia, you don't really have much choice because you are a danger to yourself and others in certain instances. Particularly anorexia, you're severely underweight, you're probably at a risk of dying because of malnutrition. So obviously you'd be sectioned because of that. lack of usefulness, negative views it conveys about psychiatrists and mental hospitals. You know, they are useful for treating disorders. People do get better when they have psychiatric assistance. And so if people are thinking that if they believe Saz in a way that's not really what he said, so if they misinterpret what he says and think that mental illness doesn't exist and that psychiatrists don't know what they're doing, it's very socially sensitive. You know, there's lots of negative impacts on that. And to access this top band, you've got to explore at least 2 arguments, which makes sense. It's 3 marks, isn't it, for each argument? Examiner's comment said, many answers showed a good awareness of Saz's central arguments. Many were able to consider usefulness, but there was a difficulty in assessing the usefulness. So these kind of like both sides, like the reasons why it is and isn't useful. More candidates were able to give detail relating to Saz and then comment on how his ideals and useful applications to understanding and treatment of mental health issues, and/or they commented on how this theoretical stance is just that and isn't really useful to a person who has experienced treatment via medical establishment. Most candidates gained 3 or 4. Less able students tended to be confused about Saz's ideas and thus were unable to comment. So if you know Saz, you should be able to comment on why it might be useful and why it might not. It's very kind of similar to that problematic question. You probably would only get one of these on the exams, which is why there's many variations of similar questions. Another one that they've asked is, why does Saz say that mental illness is a myth? Again, very similar to before, so he suggests that it's just a metaphor. He says that if mental illness turns out to have a biological basis, then it can't be that mental illness is its own thing, that it would just be a symptom of that underlying biological disease that's going on. So you don't need to have a separate like category for mental disorders because it would just be a symptom of that. And also talking about that medicalisation again, how that means that people can be coerced into treatment rather than being an active player. So it's very similar what it's asking you to write about. And again, this bit from before, so there's no such thing as mental illness, it's just our modern pseudo-medical perspective on the tragic nature of human life. So that religious humanistic perspective of life being tragic, everyone having mental disturbances that we talked about before. And then this one came with it, so the extent to which you agree with it being a myth. So we've got social control of people diagnosed. It's in the pharmaceutical industry's financial industry to have lots and lots of disorders. So creating new disorders means they create new pills, they can make more money. So that's very kind of problematic and suggests that it is a myth because they're just doing it because of this social control. You could disagree with Saz and say it's not a myth, and you could say that actually having that diagnostic label means that you can get treatment and you can feel better about it. Again, notice the repetition in the answer from a previous question. You know, if you suggest that it is just a social construct and it's not got any kind of evidence for the biological explanation, it means that people are less likely to try things like medication, which actually like SSRIs for depression and antipsychotics for schizophrenia, they are actually quite useful. They do work for a lot of people. And so if everyone believes that it's a myth and it doesn't exist and that it's just something else that we can't really explain and have no evidence for, it stops people from getting that kind of support. Again, to access top band, must express a judgment about the extent to which they agree. How much do you agree with that? Is it a little bit? Is it a lot? You kind of need to make a kind of comment on that. And then finally, assess the contribution of Saz to the alternatives topic to the medical model. This is a 10 marker. This was asked in 2023. It's very rare that they ask a 10 marker on Saz, but they did in this year. So you've got 5 AO2 marks, which is the skill of application through considering the contribution made by Saz. And then we've got AO3, which is the skill of assessment of the arguments, so the positive and negative side of the contribution. So it says on the positive side, it could be argued that Saz raised questions that others did not even see as questions. And then your AO2 stuff is like So, for example, saying that it's the tragic nature of humanity that we all have mental disturbances and that we don't need to label people as being sick and needing treatment, and that it's for political and coercive control. So all of that kind of stuff is like when you're applying it and then raising questions is that kind of evaluation. He developed a series of concepts to capture the essence of his argument that are quite memorable. That's a bit of a weak point. His critique of the medical model was powerfully expressed. He didn't deny the need for biological treatments were appropriate, he was just criticising the amount of evidence for it. He argued for recognition of people with behaviours seen as disturbing to be aided by internal ministry. So I would go with this point because this is the one that we've kind of learnt more about. This one is where he's supporting the use of therapy, he's supporting the use of having people talk to you about your mental disturbances and you finding a solution for that. So it's very much on the Carl Rogers humanistic person-centered therapy view of therapy. Less positively, it could be argued that this argument was overstated and imbalanced. He is very subjective. These are his opinions. He doesn't have any evidence either. So it's lacking that empirical evidence. People who've received a diagnosis may feel better about their disorder. So again, repetition from the previous questions. They feel better about the mental illness. They can get treatment and support for that. And so Szasz is actually making it socially sensitive and contributing in a negative way, which is why it's on the less positive side. Remember, assess means both sides of the debate and reach a conclusion to it. So you're assessing how much he's contributed to this alternatives to the medical model. You know, he has contributed because he suggested therapy would be quite useful in a roundabout way, and to not kind of be on this deterministic label inside. So that contrasts the medical model, but less positively could be quite socially sensitive. To get the top band, it says response demonstrated good assessment of the contribution made to the topic, well developed line of reasoning, so giving lots of examples, clear and logically structured, relevant and substantiated, so with evidence. We've got some suggestions of what could be in the AO1. So challenges mental health as being a myth, social construct, it being political, challenges to the medical model. So no evidence for it. And it says physical illness, not mental, humanistic, as normalises natural response. It says do not credit economics of pharmaceutical companies' profit producing medication, as this is not in the 2011 article. So although that was in a previous question, you can't put it in this one because it's about Szasz's contribution, not the impact of Szasz. And then in examiner's comments, it says candidate shows better knowledge and understanding of Szasz. The question wanted Szasz's contribution to the topic of the alternatives to the medical model. This is the bit where people drop marks. And the minority of candidates did link his views to each of the alternatives they knew. Other candidates focused on his view of an alternative to the medical model. Both these were credit-worthy. The assessment required an evaluation of the contribution, which could be both positive and negative. So you need to make sure that you're saying the contribution that he's made to that topic, so in terms of our understanding. And there was some confusion with Ros and Ham. That's not credit-worthy because it's asking about Szasz. So hopefully that was helpful to give you a better idea of what it's looking for. You'll notice it's very repetitive in terms of the question type. So if you get another question on Szasz, it's probably going to ask you something similar. And hopefully that will give you a bit more confidence and help you answer those exam questions that you're handing in for feedback. Any other questions, let me know.